Well, good afternoon, everybody. This is Alexa Pretty at CCASA. I'm the Director of Training and Communications, and we're here with you today for our April webinar for Sexual Assault Awareness Month. Today we're talking at this webinar about working with jails. We're really excited to be showcasing a model program from our member agency down in Durango. But before we get started with that, I do want to do a quick poll. Just so everybody can tell us a little bit more about you. So I'm going to launch this poll and just go ahead and click right on the screen. What profession best describes you? If you are another profession than one of the options that I gave you, go ahead and type that into your question/chat box so that we can learn a little bit more about who we have on the webinar today. As you're responding, it looks like about half the people have responded. So as you're responding, I just want to remind you that everybody's lines are automatically muted. If you have any questions throughout the webinar today, please do type those into your question/chat box, and our presenter will stop periodically to look at those and to address your questions. So go ahead and just type those at any point, and we'll be sure to see them. It looks a bit like about 70% of the people have responded that are on. So if you haven't gone ahead and clicked on the screen, please do that. And if you were one of the 44% of folks that clicked another profession, please type that into the questions/chat box so that we can know a little bit more about you. Great. It looks like some people are typing into that. So we have somebody who's a prevention educator, somebody who's a survivor, advocate, administrator, just some different folks joining us. I am going to go ahead and close that poll and share the results with you so you can see who's with us. We have primarily community-based confidential advocates, and then we have some mental health professionals with us and some of those other categories that we were talking about. I'm going to go ahead and hide that right now. So thank you for telling us a little bit more about you. Another thing to know is that the PowerPoint, for this presentation will be sent to everyone in a follow-up email. Also, immediately after the webinar ends, you'll see a quick 4-question evaluation pop up. It's really just filling out a few quick boxes, not taking too much of your time, and we really do appreciate your feedback. So if you could provide us with some information by filling out the evaluation, we'd greatly appreciate it. The other thing I alluded to, but I wanted to mention a little bit more before we get started with the webinar, is that we do have this webinar within Sexual Assault Awareness Month. So most of you know April is Sexual Assault Awareness Month, and there is a lot going on across Colorado and really across the country during April. If you want to know a little bit more about what's going on in your community, please go to our website, ccasa.org, and click under Get Involved to the tab that says Go to an Event. And you can see a calendar of events, and many of our members have included their events on that calendar. So if you are one of our members and you want to add your event to the calendar, you can just click the tab that says Submit an Event, and it's a pretty simple process. Feel free to email me at outreach@ccasa.org if you have any questions about that. The other thing I wanted to mention before we get started is our event that is happening at the end of April. Many of you are aware that April 29th is Colorado Denim Day. And Colorado Denim Day is a time where we take a stand against the myths and misperceptions about sexual violence. And Colorado Denim Day, it not only raises awareness, but it also helps raise funds for CCASA. As you know, much of our public policy work, actually all of our public policy work is funded by donations, and so we really do rely upon our fundraising throughout the year for that. So that's my last shameless plug before we get started. So I am going to now introduce you to our presenter for today. We have with us the Executive Director of the our membership organization in Durango, SASO, Sexual Assault Services Organization. And her name's Maura. Maura, are you there with us now?
I'm here.
Great.
Thanks, Alexa.
Thanks. Do you want to go ahead and share your screen with everybody?
Let's see, where did it go? I think I do this. Let's see how good I am, everyone.
Woo!
Did it work?
Yes, it did. Thank you.
Yes.
Sometimes the technology is half the battle. So with that, I am going to sign off, and I am leaving you in good hands with Maura. Thank you.
Thanks a lot, Alexa. It is really an honor to actually be doing this today, and it is my first webinar, so thank you everybody for taking the time to join us today and actually talk about working with our local jails. I know this has been a hot topic for, well, at least for us, but I've seen it statewide, and I've also seen it grow nationwide. I just had the opportunity to be at Ending Violence Against Women in New Orleans, and it's very much an important topic in all of our communities right now, working with sex assault, domestic violence, and histories of trauma. So thank you for taking time out today to actually be with us. My name's Maura Doherty Demko, and I work with the Sexual Assault Services Organization in Durango, Colorado. We serve technically 2 counties and roughly about 56,000 people. We do advocacy, of course, 24-hour crisis line. We do law enforcement reporting with victims and survivors. We go to the hospital for SANE exams. This last year we just incorporated the SANE coordinator into our agency because there were some changes in our community. And we have a little bit more that we do, but I know today I don't want to focus necessarily on everything we do. I really want to look at working with the jails and what that process has been like over the last year and a half or so. So welcome. If you do have questions, feel free to write them in the question box. Alexa is going to help me out with that. Thank you, Alexa. And we'll periodically have a couple of polls and some other questions for you as well. So just thanks for participating, and glad you're here. So why are we talking about jails and correction facilities today? You know, for us, it really became a question of who are we serving in our community and what are our barriers. And one of the things that we found in asking how can we better reach our community is we couldn't provide services for people who were incarcerated or in jail or in community corrections. So we had a referral that came in. This was probably about 2.5 years ago, and I had just started with the agency. And I came from a mental health standpoint, so I worked with a lot of trauma clients. And this referral was in need of support services. This person had a history of sexual assault trauma, sexual abuse as a child, and really had some valid needs and was willing to work on their issues. And it was a recommendation from our community corrections agency. We actually we have contracted community support groups that are free to our community members, and we contract it out. So of course we do our referral process, ask questions, and we send it over to the contract therapist. The client was refused. And the client was refused for a couple of reasons, and some of that was also mental health need. And we didn't have a solid plan on what do we do with a client when they're refused for a support group. In addition, they were refused, and primarily really because they were in the community corrections, and our support groups are funded by our VOCA funds. And so we couldn't actually, the contract therapist knew that and absolutely said, no, we will not support this referral for our group. So our team came back together, and we had the staff had changed hands here at SASO, and so we came together and said, what can we do about that? Because primarily I knew from working in trauma work that those are the clients that most need support, and we know that there are high rates of trauma. So I staffed it with our grant administrator, and he had a couple of suggestions, which was one, if we could prove that we were using other funds, we could bring them into support groups. But the other problem I ran into is if I was referring somebody to the current contract therapist, they wouldn't actually take them on. And so I had to look at what were we standing for as an agency, what was our mission, and how were we going to manage this? Because in the work that I did, I came from being an emergency services therapist into a victim services organization, and I felt like we were missing the mark. So our next plan was, oops, I already talked about VOCA. Sorry, I jumped ahead. So yes, just before I jump further, VOCA guidelines don't allow, up until August of last year, they did not allow for support services or rehabilitative services to be used, their funds to be used for incarcerated individuals or ones in community corrections. And in 2009, there was actually a National PREA Commission report that came out that really said they need to look at that. And so the changes came about in August 2014, although for us, that actually isn't in our current 2-year contract. So we've got a little ways to go, and I know VOCA recognizes the need for it, but amazingly, we had an opportunity arise. And this is really a concern because so many of our clients, especially in our small community, women who've experienced trauma do end up in the jail system. So I want to talk a little bit about trauma in the jail. First, let's look at the ACEs study. And many of you may already know about the ACEs study. It was conducted between 1995 and 97, and it was Kaiser Permanente that pulled it together. And it was with 17,000 people who actually were on a weight loss program. And what they thought is some things weren't happening. They weren't losing weight. It wasn't as successful. They wanted to understand what was going on, and they created a questionnaire. And they wanted to see what people's experiences were. What they found was more than half of those surveyed experienced at least one form of trauma, more than a quarter experienced 2 or more, and those who experienced 4 or more traumatic experiences were likely to show some of these symptoms that are on the slide. 4 to 12 times more likely to use substances, alcohol, experience depression, anxiety, or have active suicide attempts. 2 to 4 times more likely to smoke or report that they had poor health, and likely majority of 4 or more traumatic experiences were likely to have had 50 or more sexual partners. So of course, if we've worked with trauma, we understand those numbers and what that looks like. In addition, there's also higher concern and potential for high blood pressure, diabetes, liver disease, lung disease, cancers, skeletal fractures, and it actually shortens life expectancy too. So this I feel like is really important because these are the clients that we're working with, and this is what shows up. So often when we see somebody, we're not just necessarily working with that victim trauma piece that maybe just happened, or it's them coming in and reporting what has happened in the past, but it's actually that history as well that could contribute to compounding issues for them health-wise and medically. So Kaiser Health News actually did a survey as well in state prisons, federal prisons, and local jails. And what they found was in state prisons, 73% of women and 55% of men have at least one mental health problem. Federal, it's 61% of women and 44% of men. And locally, which is probably more true for us because we're in the Four Corners region and we are rural, 75% of women and 63% of men. And in my previous work, I was an emergency services therapist and actually was called to do assessments on clients in the jail who were presenting with high mental health needs, suicidality, history of sexual assault, abuse, domestic violence. So I can really identify with those numbers. And then the Bureau of Justice did an assessment, and they assessed several different sites and took surveys of about 491 randomly selected women. And what they found was 43% experienced lifetime serious mental illness, 32% had serious symptomology within the last 12 months, 82% experienced lifetime criteria for substance and alcohol abuse or dependence, and 53% experience lifetime PTSD, which tells us they're coming from a trauma background. Just to give you a visual of it, this graph is part of the Pathways Project, and it's actually looking at, and this was conducted through the Bureau of Justice assessments, and they are actually looking at some of the different pathways for women to end up in incarceration. So we do see high numbers of sexual assault, adult or child sexual abuse, partner violence, experiences of being attacked or robbed, they've witnessed violence, so that vicarious trauma, caregiver addiction, so parents were addicted and they grew up in households with a lot of substance alcohol abuse, or even a caregiver was in jail. And so when you look at that, and then the other, I found this really fascinating when I was at the Ending Violence Against Women conference last week. There was a woman from American University who actually did a study of 23 women in a halfway house. And they provide really strong wraparound support services for the women that they serve who are coming out of jail. And what she found is all 23 had experienced sex assault at some point in their life. All 23. In addition, let me get my little numbers here. 17 had experienced domestic violence. 7 had non-child sex assault, child abuse. 7 trauma related to others' domestic violence. 5 had a loved one that was murdered. Or 4 of them had trauma related to others' sexual violence. So this is who we're treating in the jail communities, and this is really a cross-section of the population that we as an agency don't see unless we're going into the jails and we're working with these agencies. Some other statistics, just because I think they're interesting. In regards to mental health, female inmates had higher rates of mental health problems than males. We just talked about that a little bit. Regarding physical or sexual abuse, nearly 8 in 10 women who are diagnosed with mental illness reported experiences of physical or sexual abuse. 57% of females report abuse before they were admitted to the state prison versus 16% of males. 39% of women in state prisons who were actually in the prisons reported that they were sexually abused before they were admitted. So they did a cross-section of the population that were coming in and surveyed them as they were coming in, and then they also polled the clients that were incarcerated at the time. That's why they're two different numbers. And then nearly 6 in 10 women in state prisons have experienced physical or sexual abuse in the past, and 69% reported that the assault occurred before age 18. This is, to me, a devastating statistic as well. 7 in 10 women in correctional sanction have minor children, and that brings the total to 1.3 million children. That's a lot of our community that is affected by incarceration and trauma experience, and it compounds. So this is really important to remember when we're working with our clients. And I have definitely seen it as I have progressed in working with the jails, as well as our cross-section of clients that do show up on our doorstep needing support and encouragement and our support services. So how do we serve this community? You know, we have limited unrestricted funds as an agency, and we run on a budget of about $250,000 a year, which $110,000 of really is devoted to advocacy. So we had to look at as an agency, look at how could we really support this community, and how could we broaden our services so that we were reaching more of the community than we had been. And that with a restricted budget is always important, right? We all know about that. So this actually was a combination of some unique experiences and some of my own history in working in the field. And I have been involved in the crisis intervention team training here in our community since 2006. We have about 150 officers that have completed CIT. Actually, I think we're close up to 200 now. I take that back. So they go through a 40-hour training once a year that is intensive and really gives them the empathy skills so that they're not using command presence in every moment. So from that relationship, I had a positive experience working with law enforcement, which has really been an asset working with SASO as well, with our agency. We brought that to the table. And then in addition, we have a CIT part that works with our detention offices. And so I had an opportunity to really get to know some of the deputies in the jail and really work with them and build their skills in using empathy when they were working with their clientele. And I kept hearing about how they had trauma with their clients and they didn't know exactly how to manage that, and they just soaked up all of that information. So about that time, we were looking at reapplying for the Rural DV grant. Alexa, do I have a question in there by any chance?
You have some polls, but I don't have one at this juncture.
Oh, darn it. I think I screwed up and didn't ask the questions anyway because I was talking.
That's okay. You can ask the questions whenever you'd like.
All right. Well, maybe we'll do that like at the break or something like that. So I was curious, and actually I guess I could just ask this question right now. If you don't mind writing in, how many of you out there actually receive rural DV funds and are using them to provide services in your communities right now? Can we take 30 seconds to, what would be the recommended amount of time? 30 seconds to just write in an answer?
Yeah, I think just kind of, if you want people to just say yes or no, maybe make it quick.
Say yes, and just maybe the program that you're using it for, whether it's advocacy or prevention in the community. So you can just write yes or no. Thanks, Alexa. Sorry. This is my first time doing this, so thank you for bearing with me on it too, because I'm figuring it all out. So with us, we had been part of a collaborative and we're part of rural funding, and then we had a year that we didn't receive the funding and had come back together as a community, and it was 5 different agencies. Let's see if I can switch this. There we go. And so we were going to reapply for these funds, and I knew that VOCA wouldn't actually cover working with incarcerated individuals. So as a team, we came together and worked with these other 4 agencies to come up with a plan. And interestingly enough, Rural DV is interested in working in advancing PREA and also in providing support services for incarcerated men and women. So it just looked like it was a perfect fit. And we put together a plan. So we actually wrote up the grant. And it was these agencies working together. It's us for sex assault services. Alternative Horizons is our community domestic violence agency. Our Safe House, which of course services both our clients and Alternative Horizons or women who are in danger and in need of safe space. Our Archuleta County Victims Assistance Program, which is our sister agency in our nearby county, and all of us serve the 6th Judicial District, which is San Juan County, La Plata County, and Archuleta. But Archuleta County Victims Assistance really focuses on Archuleta County, so we just partner with them and provide support so that we're not doubling up on services. And then lastly was the Violence Prevention Coalition, which really was a coalition of different providers in the community so that we could stay in touch with each other, keep open communication, and make sure that we were providing the best services to victims here. And unfortunately, that disbanded this year. And some of that is because we really do have good working relationships with each other and keep showing up for that. Hopefully we get to continue that too. So through this partnership and collaboration, this became an opportunity for us to reach out to some neighbors that we weren't able to actually do that with. And one of them, the first one that came to mind, was Hilltop Community Corrections, because they were the ones who had referred our client to us initially. And they really let us know that they felt stuck because they wanted support services for their client, and this person was willing to work on their own issues and work on their history and start some healing for themselves. So that was important to us. How could we actually serve that clientele? And then also the VOA Safe House, that really was kind of a byproduct of this grant, because they were one of our partners and we had an MOU with them to share services. And that was one of the things that we recognized in working with the Safe House, is that for women who are there, it's difficult to get transportation around town. It may not be always safe. They may not have the resources or the ability, or because of trauma, they may not be in a mental state where they can access things and follow through on them. So this gave us an opportunity to actually be there on site and build rapport and relationship, not only with their staff, but also with the clients. And then the last piece was working with La Plata County Detention. And that was the new piece. And I thought originally where we were going with it was to develop PREA services. So that was what was on the table, and we all ended up at a conference together here. Karen had come down with, Christine, I can't think of Christine's last name, from Just Detention International. And they did an amazing presentation for us on how to work together in the community, because PREA was coming up, and last August it was really being mandated across the states in all of the detention centers. So through that meeting, we started a conversation. Now, when you think about that, we wrote the grant February of 2013. The conference was actually held December of 2013, and we didn't actually find out about the award until September of 2013, and it began the end of September, beginning of October. So at that point, we were a couple of months into it, and we were starting to figure out what would that look like for the Safe House, what would that look like for Hilltop, and trying to build those programs, because we just had an idea. And with the detention center, it was, well, we want to do PREA, and we need to use you in this way, and we have a PREA coordinator, and that's where it'll come in. But that changed as we worked with them. So what actually ended up happening, sorry, I guess I covered this. I'm not paying attention, I'm talking. That's what's happening. So as you can see with the Safe House, that was easier to collaborate with, and we got started pretty quickly. With Hilltop, it took a little bit longer, and what we found there is, it's much more challenging. We started going up there and doing training for the staff. We did a specific training for their client managers and then another one for their online staff, just on understanding trauma and how to work with clients if they come forward. And what does that look like? Because that setting, it's residential, but it's still a correction setting, and there's a lot of rules and regulations that fall into that. So the other piece that we did, just to be creative, was we actually went over and did a healthy relationships class at Hilltop. And we had initially 4 men sit down at the table, and we worked on building a collage and teaching and talking about what goes into a healthy relationship. And by the end, we had 7 people at the table and 19 in the room, 19 in the room. And everybody was listening, asking questions, and participating. So we thought that was a great start. But interestingly enough, when we actually go up there and do the 2 hours a week in service, or not in service, but advocacy services, it's much more difficult to engage clients up there. And we're still trying to figure out the nuances of that program and how to best serve. And I'll finish up on that a little bit later as well. And then, of course, there's the detention facility. So I began by meeting with the jail staff. And there's a lieutenant on staff there. Her name's Holly Azal, and she is a super dynamic woman. And we were really lucky because now we know outgoing sheriff had some great people who were managing programs, and he was supportive of bringing services into the jail. So that's been Holly's focus. She's also the person that I have worked with on the CIT committee and actually done the CIT training with. So I had a relationship with her that was existing, and she already trusted me and knew me as a professional. So that was really a benefit, and that has worked for us as an agency. So we met, her and the assistant director or assistant lieutenant, she's really a lieutenant, who helps run the jail. And I did meet with the PREA coordinator, and we talked about programming. And what I put to the table was, can we come in and do 2 hours a week advocacy? And then we will be your community collaborate, because with PREA you have to have an outside community agency that is trained, and you have to have a procedure and policy to protect not only your staff if there's an allegation of sex assault, but it takes it outside of the jail. And so logically, we're the community agency, so we are who she would work with, or who the jail would work with. So we started talking about this, and they weren't comfortable with having staff be there 2 hours a week and just randomly working with people. They were fine if somebody actually put in a request to meet with an advocate, but the parameters were we had to complete their training, and we also had to abide by the jail rules, and then figure out a way to make that work. And what she came up with was she wanted us to do a group. So after a couple of months of meeting and talking, it just so happened that we were at the Colorado Advocacy in Action conference last year that was hosted by CCASA and CCADV. And at that conference, we saw Stephanie Covington present on her healing trauma her healing trauma group. And she had already been using that in the jail settings. And it was actually set up so that you could have a layperson do the support group. So as we were learning about it and studied it and then took it home, it really seemed like that would be a great fit for us to bring that into the jail and do that for a couple of hours a week. It's only a 5-week group, and to actually provide services to the inmates, the women there, and do a test run and see how that works. So I went in with a presentation on that, and there were some adjustments, like you can't bring scissors in, and you can't bring magazines, and we can't watch movies. They don't get paper clips or staples, things like that. So I had to make some adjustments in what are the projects that we're going to work on and how does that look. And I also had to have permission for them to get me paperwork. But at this point, we still don't have something going, and this is June of 2014. So our grant funding has been going on. We're actually providing services at Hilltop and at the Safe House, but I can't get us in the jails yet. And part of the responsibility is they only have 2 volunteer trainings a year. So we actually have to participate in their volunteer training and get clearance and do a background check before we can bring a program into the jail. So I'm starting to get really nervous, and then as I'm communicating with some other people, I realize that sometimes this is normal. You have to actually work with what the situation is. Keep that relationship going, keep working through it, and get it set up. And it just doesn't always happen overnight. That's something I've had to actually sit with, and it's not always that easy. So our jail, just to give you an idea, it's a locked, secure facility. It has 2 women's blocks, and it usually averages somewhere between 15 to 25 women on site, and often it can have 6 women in the 300 block. So the numbers vary. It's set up for up to 400 inmates, but on the average right now we vary between 100 and 108. And the volunteer clearance is mandatory. But what I really respect is that they care about working with the clientele, and they recognize that the clientele do have trauma histories and often are repeat clientele and customers, so to speak. And so they've been looking at what are better ways that we can serve our community. And what they've been doing is building relationship with our local mental health center, which has become an integrated behavioral health center. And so they got a grant for about $300,000 to bring services to the jail, which has been really effective and incredible. So not only that, they have great volunteers in the library. They have the traditional Bible study and church volunteers that come in and work with the inmates. We're there. They do drug and alcohol treatment. It's just been, and then they also have a psychiatrist who's there 3 days a week who provides medication and then actually can provide support for the clients as he can see them. And when I started working there, they only had somebody 1 day a week, so it can really tell you the need and how that program's grown. And I'm proud to be part of a community that's invested in all of our community members. So this tells you a little bit about what I said. So we did get approval in June. I went back with a plan and said, what do you think of this group? And they loved it. And it was a great place to start. So the next step was we had to sit through the training. And so 3 of our staff were designated, and we chose not to use advocates. And the jail had asked that we don't use volunteer advocates. They want them to be staff members who come into the jail. So we actually did our training, and at the time, I was the only person who could actually fit the jail group into my schedule. If you can imagine, you don't get a lot of choice in, hey, I want to do the group on Thursday nights at 5. What was open was Friday afternoons, and so Friday afternoons it is, and it's from 2 to 4. So we got cleared through training. All of our background checks, we did our 2.5-hour training with them in June. We got approval for the program, and we weren't able to start the group until August. So almost a year after we found out that we had funding to actually support this was when we were actively bringing the program to the jail. Patience is a virtue. So Alexa, is this my turn?
Are you ready for me to launch the poll?
Yes, ma'am. Would you launch the poll? See, I got one of them at least.
No problem. Here we go. So this one is, how many children are affected by mothers or women caregivers in the correction system? You could choose 100,000, 247,000, 899,000, excuse me, and or 1.3 million. So go ahead and just type on the screen there what you think the answer is. Okay, it looks like almost everybody's finished voting. So if you haven't, go ahead and just click real quick. And then we'll close the poll and share the results. It looks like a lot of people are choosing the same one, so we'll see if that's correct. Okay.
Actually, I think you all have been paying attention, so that's awesome.
Okay. Looks like we had 83% say 1.3 million.
Awesome. Great work. You guys are paying attention. So that's a huge number, and it really it has huge impact on our communities. So just something to remember. Well done, folks. Oops, sorry about that. I just clicked on the wrong thing. So introduce healing trauma. And I don't know how many of you were at the Colorado Advocacy and Action Conference last year, but we were lucky enough to be able to go for the first session, the pre-conference day, and saw Stephanie Covington speak. And she's done some amazing work. Her group programs are evidence-based, and she has men's programs as well as women's, and she had created this one as a shorter version of her women's group to actually connect with people in the jail or sex assault agencies, domestic violence services agencies, where we have more of a time constraint, and we're looking for something that is really easier to implement. And so this one doesn't go into the depth that her men's, I think the men's group is 13 weeks and her women's is 11. And they talk a little bit more about substance abuse and how people who have experienced trauma, especially around sex assault and domestic violence, but really there are so many different kinds of trauma and we all respond so differently. And substance abuse and alcohol is a coping mechanism. And so she really brings that in and works with that as well as teaching some healthy coping skills. So we have found great success with her and with her program. I actually just purchased her the other extended men's and women's group programs because I'm trying to look at what do we do next and could we take it one step further. So just to give you a little idea of what each group looks like, there's 5 sessions. The very first one is really introductions and understanding trauma, what it does to us, how it impacts us. And so she starts with just some centering and your typical starting with ground rules. I found that even though it's not really discussed heavily, because it's a jail setting and every time, one of the things that I've learned is you never know who's going to show up. It's not a closed group. So front loading a lot in the beginning is really, really important. And explaining that even if some things that we talk about may be triggering or may create some discomfort or sadness, emotions, that every time we do that we're healing a little bit. And so there is an opportunity, and then also we're working on building skills for them so that they have a way to self-regulate and take care of themselves while they're doing it. And the cool thing about this group is really and truly staff members can actually run it. It is fully instructional, it is step-by-step basis, and it's really more psychoeducation and resource building. So there's an opportunity for them to do some creative outlet, and every group has a creative component to it, because that not only gives them some space to release some of whatever their experience is or discomfort or their emotion, whatever they're experiencing, but also it gives them an opportunity to create some inspiring artwork or symbols and things that they can take away with them, which is really neat. And then in this particular group, we introduce a grounding exercise called the 5 senses. Some of you may know it, where you just close your eyes, breathe, open your eyes, 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing you can taste. And you walk through that, and it really is a grounding experience. And for so many of these women, they don't have that ability to regulate themselves. And so even just these entry-level skills are super important for them. In session 2, we go more in depth in understanding what trauma is and how it affects the brain, and also what the power and abuse cycle is. And I'm sure this looks really familiar to a lot of you, but it's amazing to me in working with these women how incredible the conversation is, because they really take it and they've been able to share it in a safe, valid way, and we do a lot of support around this is confidential and this is a safe space, and please honor that with each other, because I know that in the cell block sometimes there's different relationships and there's animosity and history, so we really talk about that being a supportive environment. And my experience so far is it has been. So referring back to ground rules, and it's about how the facilitator manages it. Okay. And then in this one we actually introduce the safe place as a resource. So there's an exercise and we create the safe place or go to it, and then they can add or subtract anything that works for them or doesn't, and then that's a tool that they can use. And the feedback that I've had has really been positive on that. And occasionally what I've seen is there are clients who have drug history and it's really difficult for them to focus, and so where you may have somebody who has that ability to stay at attention longer, in this particular situation you have to gauge that for the clients you're working with, and sometimes doing a little shorter break, shorter session, shorter time is more supportive, and then you extend it the more you get to work with them if you get to. In the third, we really focus on grounding and soothing, and what I have found is many of them, they don't have that internal self-regulation ability, and resourcing. And so they really respond well to this. And it's also being encouraging of what works for you. This may not work for you. I know a lot of this probably sounds familiar to all of you, but it's amazing to me how this type of skill has been received so well by the women that I've been working with. And then we also talk about the process of trauma and what are the steps if you get triggered, and then what do we do to respond? Do we withdraw? Do we self-medicate? Do we become internally abusive? Do we become externally abusive? So what are the ways that we manage it? Are they healthy? And they have really great insight. They've been incredible. And then session 4, this is really cool because you get an opportunity to talk with them about what is a healthy relationship. What does that actually look like? And at this point, they're a little more comfortable with how do they center, the ground rules and understanding and front loading, but also like what matters to them in their relationship, and is it okay for them to actually ask for that and say that this is what I want and what would that look like in my world. And we really talk from compassion, mutuality, and respect. And there's this great exercise that you do, and you write different terms on index cards, and they're flipped upside down like puzzle pieces, almost like you're playing concentration. And then everybody goes around the circle and flips over a card, and they talk about communication or respect. What does that mean for them with an example? And they just are incredibly insightful. And they have some tangible things that they can actually reflect on, and then they can jot down some notes so that they have that to take with them. Because so often we're having conversations with our clients about what do you need to do right now? What's the safety mechanism? So I think in some ways it's been really surprising to me how engaged they have been, and how much I have learned just by showing up and sharing information and allowing them to share from each other. It's been very powerful. And then, of course, we have the final session. And this is about endings and beginnings. And why it's presented that way is because so many of our clients who have grown up in trauma and experienced ongoing trauma, they haven't had great experience in endings. I mean, if you think about clients who witnessed domestic violence or sex assault or child sex assault, or parents who are incarcerated or drug and alcohol addiction, some of them have been in and out of foster care. Maybe they were the parentified adult. There's so many different pieces to it. They had to resource themselves so that they could feed themselves or feed siblings. And so endings, they weren't really taught. How do you do closure? What does that look like? Things end abruptly. And it's safer than actually having full closure. But yet it's still disruptive. And so this is an opportunity to talk about that. And one of the neatest things that you get to do in this group is practicing appreciation with whoever is in the group. And so there's this opportunity to go around the circle and share what you appreciate about the person on your left or the person on your right. And it's really incredible to watch these wonderful women do this, because you can see that it doesn't feel comfortable to them, and you can see them stumble, and I set up some examples for them, but it opens a door for them to actually look at who's sitting next to them and see some good in them, and also hear the good in themselves, because often they don't get that feedback either. And so pretty amazing. We do some reframing around what goodbyes look like, and past, present, future. And then each lady actually gets a gift certificate for completion of the program. Whether this was their first day, this was their last day, it doesn't matter. They are included in the gift certificate, and they're each honored and acknowledged for that. So it's a really special, to me it's been a very powerful process in working with these ladies and their feedback. So far, SASO has completed 3 cycles of these sessions. On the average, we've had 4 participants per group, but they're, in the beginning, I ranged between 2 and 10. I don't always know who's going to be there, and I don't always know who's going to show up. Average is there's 12 women on the pod. In the planning for the program, the way that the group is written, there's a pre-test and a post-test, which you can imagine if you have people dropping in and out. The first group, I had 6 women. The last group in the first session, I had nobody. And then the next week I had a lady attend who hadn't been to any of the others previously. And so it really depends on the dynamic in the group. It depends on who's the stronger personality on the pod or on the block. Building rapport is important, and at the same time, it doesn't really judge whether people are going to show up or not, because they're very much in their own internal process. Did they just get sentenced to DOC? Did they have a bad visit? And Friday afternoons, for some reason, they get court sentencing, so they were getting a lot of bad news on Fridays before I would see them. So the one thing that I've learned, no matter what, is be flexible. So feedback. So the post for the 5-question, that's the original, and you can see a little model of what it is. And the ladies don't get pens or pencils. They get markers and crayons, and that's approved. But you have to count them when you're pulling them back in, so you know nobody's walking off with them. There were 2 yes and no questions, and both were answered 100%, that they knew what, they knew what sexual violence was, they could identify it, and that they had learned a new skill. And then the other 3 questions were 83% said they were able to answer 3 ways power and control can show up in an abusive relationship. 100% were able to share 3 ways to ground or soothe themselves, and 100% were able to list 3 aspects of a healthy relationship. And there were just a couple of comments, so I put those up there just so you can see them. And it definitely gives them an out, but it's not a totally comfortable scenario. So there is learning that's expected to go on, and they can participate to whatever level they want to. But ironically and interestingly enough, they participate. On some level, it's been an environment where they have. So we actually looked at how do we switch this, because of course we need evidence-based information to actually give to the grantors, and we also want to see, are we actually doing what we think we're doing. So what we did was we changed this model to a 5-question Likert scale post-test for every session. And we're just administrating this in this particular round. I only had 11 total post-tests from the first 2 sessions, and those are the statistics you saw. But in this particular, we've got 2 sessions right now, and we'll be collecting the next. So just to give you an idea, you have a better understanding of what trauma is and the forms it can take, both emotionally and physically. As you can see, it's mixed responses. 50% strongly agree. There was one person who, I think no, actually that's right. So there was one person in this one, because I only had 4 surveys, who answered everything strongly disagree. And to this point, I'm still not quite clear on whether she just strongly agreed with everything because she had a positive statement at the bottom, or if I didn't explain the Likert scale very well. So hopefully in the next session I'll do a little better job on the post-test. But you were able to develop a goal for yourself in healing during session today. 50% agreed, 25%, or 50% strongly agreed, 25% agreed. So the majority. The activity provided a way for you to creatively express who you are to the group. Again, we've got about 75% that agree or strongly agree. And the 5 senses grounding exercise was helpful to you. 75% really felt like that was a positive. So I thought that was very telling, and it'll be interesting to see how things progress as we keep going. The wins for us, we're actually in the jail working with people that we would not see otherwise. We've consistently had attendance. After I had the first session, the last 2 parts of it, or the group 5, and I actually had to do group 5 twice, we had nobody come. And so I was looking at what am I doing differently, how do I change that, and what I found was if I actually go to the block with the deputy, the ladies recognize me and they'll come down. And not once, I mean, and they're always, it's a choice, but it's interesting that if they see me, they're like, oh, okay, you're here, and then they come down. And now what I've noticed since we're on our 3rd session is I don't even have to do that anymore because we have deputy buy-in. And they go and get people, and they've really heard the feedback that it's a good group. People really benefit from it. They appreciate the conversation, and they're learning. So I'm constantly learning what works. How do we do this better? How do I engage people? And of course, the other positive is it's created crossover for our clients as they're leaving the jail or they're leaving the safe house or going into the safe house or they're in or out of community corrections. So that's also really important as well. Because I've had conversations with women who are getting out in the next couple of days and they have no place to go. And so we talk about how are you going to contact the safe house? What would work for you? Where can you be that is a good environment or more positive environment? And if you do need resourcing, you're welcome to come by the office and we'll connect you with whatever we can to the best of our ability. As you know, we're in a rural community, so resources can be pretty slim, but we do a good job of coordinating them and really trying to do our best in taking care of the people who live here. And then, of course, we increase our community referrals because people are more comfortable with us, they are calling us, and we've been able to give better follow-up care to our clients. So those are some pretty great wins. The challenges that we've experienced, of course, because there were a few, was the slow start. Getting approval for the program, actually figuring out a plan, getting all of our team through volunteer training, getting a begin date, and the learning curve of how do we actually engage all of the clients or the women in jail in the block. Another piece has been staffing, which I think is in the next one. Yeah. So no attendance. That's a huge challenge. I show up at the jail and nobody's coming. I'm like, okay, what am I doing? And truthfully, initially, my own ego was in there. You know, oh my gosh, is it something I did? Am I not doing a good enough job? Which, of course, logically, realistically, I know I'm dealing with this particular population, and I need to understand that that happens. But there is my own ego stuff that showed up too. Now, you know, what do we do with the attendance? 1 week it may be 2 people. The next week it might be 10. How do we plan for that? Changing our program to meet the needs of the jail. This wasn't what I intended to go in with. I really just wanted to do 2 hours of advocacy, and yet this has been much more successful, more so than our programs at Hilltop and at the Safe House in our perception. We have more engagement. We actually are accessing more people, and we're providing a better service, I feel like. It's definitely been used more. Being flexible, sometimes you don't want to be flexible. And especially when we're doing crisis work, you have to be flexible. So just working with whatever shows up. 1 week I went to the jail. There was a woman from the Bible study group who wasn't supposed to be there, but she was in with a client. I actually left, and she didn't understand the schedule piece. And it was really neat because the deputies actually said, no, we like you here. You bring benefit to these women, and we want you here. I'm really sorry that happened. We'll do whatever we need to do to have her out of the room because she wasn't scheduled. So it's interesting to build that rapport with them and actually really get their support and see that our work is being validated and how the women respond to the deputies too. Evaluations have been a huge challenge. How do we actually gauge what we're doing? As you can see, we're working on that every day. And then scheduling is tough because we have a pretty rigid group time. I think I mentioned this earlier, where a group is actually on from, it's 2 o'clock until 4. And the group is supposed to be set up for an hour and a half, so it should be 2 to 3:30. I have yet to actually do an hour and a half with these women because they are engaged, and so we've been managing it about 2 hours every week. But that's challenging, especially in a crisis environment, because we have committed to providing that service every week, and it's Friday afternoon. So again, that can be a challenge. And then staffing is hard because we can only have 3 of our staff. Well, now I'm the only one actually who can go into the jail because we've had staff turnover. As you know, with nonprofit agencies and especially crisis-oriented agencies, there's staff turnover. Our goal is to keep everybody for at least a year and a half, but sometimes that doesn't happen. And it's not like I can just send somebody to the jail training tomorrow. Right now we've had a changeover in the sheriff's staff, and it's going to be a little bit before we actually have another jail training. It might even be this fall. So until then, I'm the one who's slated to actually do the jail group. And then I realized that I've talked a lot about trauma, and I've talked a lot about what does it mean to get into the jail and work with them, and you're probably wondering, what does this have to do with PREA? Well, the Prison Rape Elimination Act, of course, we're all under scrutiny for that, and that's why our detention centers and jails and correction facilities are going to be reaching out to us. So it is a hot topic for all of us, and what I present is, even when you think you're showing up for one thing, to build rapport and build a relationship and set up an MOU and create policy and a system to provide a service, advocacy service to cover PREA, you never know what's going to show up. That's that be flexible piece. So in our community, we've got 4 detention centers. We have the La Plata County Detention Center, we have Hilltop Community Corrections, we have the Southern Youth Detention Center, and Denier. And Denier is our youth facility. The youth facilities actually have their own PREA standards, but because we've been working with the La Plata County Detention Center and Hilltop, we're actually in conversation with them about the MOU, and again, we started that process a year ago, and we still don't have an active MOU in place because there aren't staff devoted to it. We have an agreement, we have a best practice policy in our community, which if somebody is reported as having the sexual assault experience, police are called, they're brought to the hospital, advocates are brought in, they're contacted immediately. So we all work together, and that is best practice when it comes to PREA, but we still need to have that MOU in place. So I'm looking forward to actually working that out this year, or at least that's the plan. And then in the process of all of this, the Southern Youth Detention Center reached out to us. Their nursing staff is going to be responsible for their PREA work, and she's interested in taking that on, and so she and I have been building a relationship, and I'm sharing. I got my MOU pieces from Pitkin County, who presented at our conference last year, and they're leap years ahead as far as the PREA MOU and having a plan. So I think we're in different stages, but it's remembering that you just have to keep coming back to the table. So for us, the steps that we're in the middle of, sorry, I just realized I'm closing out on time, I apologize. So the steps that we're working on, first we're developing a policy. While the jail is doing that, so will the detention center. And then we're that community agency. And then also creating an MOU. So really that's kind of where we are right now with PREA. And I trust that I'll have more information. And if anybody has questions, or if you want to collaborate on anything, or if you need support, feel free to please give us a call. I'm glad to work with you and share anything we've got. But we do have that best practice in play, and that's what we're using as a ground base. Next steps will be education for the jail staff, some of that, and for Hilltop, and for the detention center. And I see that as ongoing over not only the next couple of years, but in the future. And for us, training to meet agency criteria for them as well. They do have to put in a phone system where the inmates can actually call out for free to an advocacy center if they want to report, and it will not be recorded. And then we need to make sure that we have clear procedure for all of our staff who are responders. And then, of course, the third step is we respond, everything's great, we're on it, we review it, and hopefully we'll be able to set up a SART team, we'll do follow-up, and then again we'll respond again. So we are definitely in the first steps, and all of this works together for us to build our community and provide support for our community. Thank you very much, and hopefully I still have you guys hanging in there. I just really appreciate you being here today, and I'm glad to answer any questions if you have any. I realize I just ran up against time. I was trying to do better than that. Here are a couple resources if you're interested, and I can email you anything I've got too. But I'm glad to open it up for questions, or I also want to honor everybody's time. If that doesn't work, you're welcome to email me and I can give you that information.
Laura, it looks like Carmen was wondering if this curriculum is culturally sensitive to be used with the Latino community. Do you have any thoughts about that?
There is a Spanish-speaking version of it, and I do feel like it is because I've had a mix of Native American, African American, and Latin clients that I've worked with at the jail so far. So I do feel it is, and the curriculum does come in Spanish as well.
Great. If there's no more questions, I don't know if anybody's typing. Oh, great. Can you share how you can get the curriculum? Is there a website or that?
You can actually look it up. Stephanie Covington does have a website, and you can purchase any of her materials if you're interested. The great thing is you do not need to be a therapist to do this, and I probably will have a little challenge back in regards to that, but that's one of the things that I think is pretty amazing about this because, of course, as an advocacy agency, I don't always have licensed therapists on staff. But with training, I think this can really easily be done. So look up Stephanie Covington, and Healing Trauma is the name of the program, but she does have other support books for survivors and victims, survivor victims. So yeah, you're welcome to look that up and go from there. And if you email her, she actually responds pretty quickly, and she's got a great staff that's a support staff as well.
Great. Are there any other questions? I'm not seeing any, and I do also agree. I want to respect people's time. We will send, as I said at the beginning, we will send the follow-up email with this PowerPoint. I believe your PowerPoint also has your contact information. Am I correct, Maura?
I think so.
Okay, good. Probably back to the front slide. What I do want to say is that we really appreciate your time, and we appreciate you sharing this information with us today.
Absolutely. It's something we're really excited about. It's been a lot of fun, and it's been a huge learning curve. And I'm glad to offer any of that knowledge to anybody who needs it or wants it or needs encouragement. But thanks for taking time out today to share this and let us get this word out too.
Great, thank you. And I just want to remind folks to please fill out the few short question evaluation. When we close the webinar, it'll pop right up for you. If you have any questions, feel free to contact Maura directly. And Rita, thank you so much for being a part of this webinar and for all you do to support survivors in your communities. I hope you're enjoying the events and getting involved with Sexual Assault Awareness Month. Once again, you can go to ccasa.org for more information about events in your community. If you have any questions, feel free to contact CCASA as well. I hope everybody has a great rest of your day, and we thank you so much for being a part of the webinar today. Take care. Bye-bye.